Geoff Gurtner. I'm the Johnson & Johnson Professor of Surgery at Stanford University. I direct our Advanced Wound Care Center at Stanford and have a courtesy appointment in bioengineering and material science and engineering in the Stanford School of Engineering. Well, the field of wound care is actually a relatively new development. Historically, wounds were taken care of by a hodgepodge of different practitioners, and so patients would, to a certain extent, be at the mercy of the subspecialization of the doctor that they're seeing. For instance, if you see a vascular surgeon, they will look to see if there's anything they can do to open up your blood vessels, but if there isn't anything to do, then there's not much they have to offer. Similarly, plastic surgeons will look at whether you're a candidate for a flap or a skin graft, but if you're not a candidate, there's nothing to offer. And I think the field of wound care has really brought together all these different disciplines under one roof, where you can actually have access to all the different specialties on one visit and have the right therapy applied to whatever your individual problem is. And I think it's much better for patients, more efficient for the healthcare system. We typically are able to get most things healed in a reasonable amount of time, and that I think is a new development in the field of wound care. Dr. Hajhosseini was my advanced wound care fellow at Stanford. He was the fifth fellow that we had at Stanford, and I met him as he began his clinical training in advanced wound care. There's very few training fellowships that concentrate on wounds. You can probably number them on the fingers of both hands. And so it's a very rare skill set. And so I think what distinguishes them is that they really have a broad overview of all the different disciplines that impact wound care. Dr. Hajhosseini was instrumental in some clinical trials of new technologies. One was an emerging technology using lasers to debride wounds. As you know, debridement can be very painful, and also it's unclear how effective it is in removing bacteria, and he led a study that showed that actually laser might be better in certain circumstances. He also did another clinical study looking at hyperbaric oxygen, which is commonly used in wound centers and somewhat mysterious in terms of how it works, and I think he did a great job defining some of the molecular mechanisms and also identifying potential biomarkers that might be useful in guiding therapy using hyperbaric oxygen. I think his best attribute is he's 100% dedicated to this clinical area, and he really is committed to his patients and really leaves no stone unturned. That plus his training, I think we have one of the best fellowships in the country, if not the world. And so he's been incredibly well trained. I think both of those things will make him very successful in helping patients. The most important lesson is really that you, I think, have to treat these wounds very aggressively, in the sense that they can't be managed with a visit every 6 weeks or 3 months. That if you really want to heal these wounds, you have to see the patients frequently, change therapies where appropriate, revisit your treatment plan. And if you don't do that, if those visits are 3 months apart, that's how you get patients that are, have non-healing wounds for 5 to 10 years. To really buy into the treatment plan and show up for all of your appointments and be patient, because it does take time for the wounds to heal, but to not get discouraged or give up, because most of these wounds can be healed, but it requires a real commitment, part of the provider and also on the part of the patient, to get that done.